Morning to you. How are you? How are you?
Any other issue you have, another family recording, or some of them not going to discuss and suggest it before any other service.
So when they live here, they move to the HIV testing services. Please let's move.
Recipient for the NAR systems.
Thank you, Liliana. Somebody to government through Global Fund in what we have been able to do with respect to. I wish to ask Mr. Muya from that now you're an old man. Because if it's the people. Thank you very much.
I'm Red Cross, Annette, health workers, distinguished member of CBOs, mabibi na mabwana, hamjamboni nyote. Habari subuhi. It's a pleasure to be here, frankly, and thank you for hosting me and my delegation. It's been an eye-opener, frankly speaking, for us, because France is the second funder of the Global Fund. And when I say that, I see more numbers, but sometimes it's hard to figure out the impact. And coming here in Migori Hospital, in this facility, I must say I come back with a very clear idea of the impact. I think the impact is obvious through Madam CEO, dear partners, AMREF, Red Cross, Annette, health workers, distinguished member of CBOs, mabibi na mabwana, hamjamboni nyote. Habari subuhi. It's a pleasure to be here, frankly, and thank you for hosting me and my delegation. It's been an eye-opener, frankly speaking, for us, because France is the second funder of the Global Fund. And when I say that, I see more numbers, but sometimes it's hard to figure out the impact. And coming here in Migori Hospital, in this facility, I must say I come back with a very clear idea of the impact. I think the impact is obvious. What I would like also to say, it's to comment, I think, this model. I'm actually even more than positively surprised by the degree of integration. I'm really surprised by the degree of integration here, where the county government, the national government, the various the CEOs, worker force, they're all working together in the direction. Sorry. So this model works because you're providing really health service to the communities, and I would like to have also a special word for the community health workers, as you who are providing really afya mashinani, to the community. So a big thank you to you. So I don't want to be too long, but that was my remarks. They're not part of my impression. So tufanye kazi pamoja, tuendelee. Asanteni sana.
Thank you.
I first like to extend my gratitude to the people and the leadership of Kisumu County who have made this visit possible and very useful. We had a very rich program yesterday. We went to see our partnership and the results in terms of water, sanitation, but also health. And I'm glad that this morning we came to Migosi Hospital. As Chief has mentioned, France is a partner of choice, I think, for Kenya in the health sector. We're the second global contributor to the Global Fund. And we wanted to see how this support has been translated in the ground here in Migosi Hospital and largely in Kisumu area. And I'm glad to find out a very, very integrated system whereby the support from partners through Global Fund, through principal recipients being AMREF or the Red Cross, and with the support of the county government and the national government has enabled to make great strides in the fight against tuberculosis, malaria and HIV. And I come back from this visit with a very upbeat and positive note that together we can do it and we can make progress. Pamoja tunaweza. Obviously, I think there's an emphasis that is already being made on prevention and sensitization. I think a lot is going on that. Perhaps we can do collectively a little bit more because, you know, in terms of healthcare, if you do a lot of prevention, you help yourself when it comes to the care stage. I can see a lot of committed people that are going to the community. I like to pay tribute to the community health worker who are doing a tremendous work in the county to bring Afya Mashinani. So I'm very hopeful we can strengthen the already existing system to make even better progress.